Hi everyone, it's Dr. Ryan with another video review of one of the Step 1 Free 120 questions. In this video, we're going to take a look at Block 2, question number 17. So this question describes a 36-year-old woman who has hypertension for which she takes lisinopril, and she's had no menstrual periods for 6 months. On exam, her uterus is consistent with a 24-week gestation, and a pelvic ultrasound is done, and it shows oligohydramnios and a misshapen fetus. And so based on this information, what they want to know is the most likely cause of the fetal abnormalities in this patient's pregnancy is interference with which of the following? And they give us 5 answer choices, which I'll let you read to yourselves. Okay, the first step to answering this question is to recognize that this is a pretty classic case of Potter syndrome or Potter sequence. So Potter syndrome is a complication of pregnancy when the fetal kidneys aren't normal. So the fetal kidneys produce amniotic fluid. So if they're abnormal, there will be oligohydramnios, meaning decreased amniotic fluid. And when there's a low amount of amniotic fluid during pregnancy, pressure forces can affect the development of the baby. So the baby can be misshapen. You can have abnormalities of the face or the limbs. And then the third thing that can happen in Potter syndrome is because the baby's lungs don't fill with amniotic fluid, they are underdeveloped. This is called pulmonary hypoplasia. And so this question is describing a pretty classic case of Potter syndrome. And there's a very clear reason for why this pregnancy has a baby with Potter syndrome. It's because the mother is taking lisinopril. This is an ACE inhibitor, and ACE inhibitors are contraindicated during pregnancy for just this reason described in the question, because they can interfere with fetal kidney development, and the feared outcome of an ACE inhibitor in pregnancy is leading to Potter sequence that affects the life of the baby. So once you understand that this is a case of Potter syndrome, they're just asking interference with what leads to Potter syndrome, and the answer is answer choice C, fetal renal hemodynamics. ACE inhibitors disrupt the renin-angiotensin system in the baby, and the kidneys don't develop normally, and that leads to underproduction of amniotic fluid and Potter syndrome. All right, let's look at the wrong answer choices one at a time. Answer choice A is fetal lung epithelial differentiation. This is not correct. So as we discussed, lung problems in the baby do occur in Potter sequence, but that's not what the ACE inhibitor interfered with. This case is clearly describing an ACE inhibitor that interfered with fetal kidney development, and that's what led to Potter sequence. So answer choice C is the best answer. Answer choice A is not what was interfered with by the lisinopril in this mother, so that's not the best answer. Answer choice B is fetal lung and surfactant development. This is incorrect. So surfactant problems lead to neonatal respiratory distress syndrome. This is going to present in a baby who was born prematurely and now has respiratory problems. It's not going to describe a case of oligohydramnios and misshapen fetal parts like the head and the limbs and things like that. Answer choice D, maternal placental perfusion. This is also not correct. So ACE inhibitors don't really affect placental perfusion, and placental perfusion problems have nothing to do with the development of Potter syndrome. The main place where placental perfusion is abnormal is in preeclampsia and eclampsia. And then lastly, maternal prostaglandin synthesis. This is not an element of this case. NSAIDs, if they're taken during pregnancy, can lead to prostaglandin problems, and that can cause problems with the development of the placenta, but that has nothing to do with this case of a woman on an ACE inhibitor whose baby has Potter syndrome. And that concludes our video review of the Free 120 Block 2 question 17.